Well, absolutely. And with COVID, I think that we have realized the value of the data in health. We are now trying to draw the conclusions of what happened in the pandemic, and we tried at that point to have the same strategies, or to put in common the cases and that kind of thing. And now in the routine clinical practice, we realize how important for us is to share the data, not in terms of exchanging, but to know what's going on not only locally in the hospital where we work, but in other sites. What is going on? How is the outcome of the treatments? What is the survival? From our experience with Clarify, we have developed a Clarify platform to be able to integrate not only the data from our patients from different pathologies, but also data from more than 150 hospitals in Spain, which means that we are able to see what patterns do we have regarding the population, what is going on in every community, in every hospital where the patients are treated for a specific pathology, all of them oncological pathologies. In oncology, we have such a big heterogeneity into patient that we have to work with data not only from the patients that you see in the consultation, but what is going on with the whole population, and if this can be regarding the whole country, then you can optimize the access to the treatment in itself, the follow-up, you can personalize the care of the patients, because you can also manage the let's say the expectations of each type of patient, and really do personalized medicine. But for that, we need data, and we need to share all of this data. It's not a matter of creating networks, but we need digital tools, and we need artificial intelligence tools or techniques or algorithms that learn from all of this data to support our decisions, and how we treat the patient, for how long, what are the experience from previous patients, in order to learn for upcoming patients, and all of these to be adapted with new therapies, with new treatments. Normally, what the challenge that we have is that follow-up care in this case that has to do with Clarify, which is the follow-up where the needs are completely unmet of the patients, because what we have is longer survival of our patients, but the follow-up care doesn't meet the new treatment, so it's completely outdated. So what we are trying now, with retrospective data integrated in our platform, but that we feed with new follow-up data, and what is going on daily with the patient, clinically speaking, from the clinical point of view, or what happens in the consultation, but also what the patient reports, the quality of live data that we collect from our patients, the wearables data that also allow us to know what happens when they leave the hospital. So if with all of that data we're able to, first to integrate it and to have a broader view of the patient's health status, then we can design all of these follow-up, more specific follow-up, depending on the patient. It's not the same metastatic patient and early stage patient. The pathologies are completely different. A young patient, younger than 50 or 45, or an older patient, they don't have the same priorities. Their life is not the same, their lifestyle, everything. So we need to know what are the priorities for each kind of patient, risk factors, and in order to improve prognosis. But that has to be always like really personalized for each kind of patient. We can't apply the same strategy for every patient, every pathology. Okay, so and for example, for the democratization of healthcare, the same, the access to the studies, to the trials, everything. So we really need to be able to integrate the data and to have the tools that us as clinicians can use, also the patients, but especially clinicians and healthcare institutions that allow us to access all of that data. And because we have learned that the more data we have, and we are not talking about a sample of, no, instead of 300, let's include 500. No, we're talking about big data, so it will be like larger volumes of data, and it doesn't have to include really sensitive data. Because this is also something that we are really facing, all of the problems with the data privacy. But there shouldn't be such a challenge, because in reality we don't really need so much sensitive data. Okay, and it can be pseudo anonymized, but it's very important that we know what is going on, not only locally, but also at a broad level. For example, what is going on with outside of Madrid in this case. Our experience in Clarify has been very good at a local level, but also, for example, regarding lung cancer, we have integrated data from patients from all Spain and from a lot of hospitals. So that gives us an idea of the differences within Spain. Imagine if you could do that in Europe, the whole Europe, or different or similar countries with similar healthcare systems. Then we could optimize resources, and it would be easier to design strategies and of course to reduce costs, because now because nothing is connected, we don't work together out of, for example, scientific societies. So it's very difficult. Even in Madrid, we don't share a common health data system. Each hospital has more or less a different isolated one. So if we could share what is going on, not only in the same community, but the same country or at a national level, imagine it would really optimize the healthcare of the patients.